Hello guys, welcome to my channel SV Dhirvani. Today we will gonna discuss about a certain type of X-ray which is called OPG, also known as orthopentanogram. It in local language it is also called as full mouth X-ray. This is an extraoral type of radiograph which is widely used in the field of dentistry. Why we are opting for this kind of radiograph in our field? It saves a lot of time. Patient is not unnecessarily exposed with different small x-rays. The exposure of this radiation is less than the other type of x-rays. You can find any kind of anomaly or abnormality, and this is also useful for a proper diagnosis. If you want to diagnose something, this is an radiograph, you can go for it. So we are going to discuss about its indications of this kind of X-ray in different fields of dentistry. And before that, what we will do, we will first of all see what landmarks are visible in this kind of X-ray, in this kind of OPG. So first of all, we will gonna discuss about the structures. Now look closely and hear closely. As you can see in this OPG, you can see the teeth. The teeth are present in both the upper and the lower region, the maxilla and the mandible region. The teeth are present. Here you can see number of teeth, they are present. And what you can see here, you can see the chamber, the pulp chamber of the teeth. You can clearly see the pulp chambers along with the pulp canals. Other than this dentition, the teeth, what you can see the other structures, look at here, look at this bulgy structure. This is the condyle. This is the condyle structure. Over here, this is a notch, and further extending anteriorly, there is another structure. This is called the coronoid. In the right side, you can see it clearly visible here. Both sides bilaterally, you can see the condyles, you can see the coronoid, you can see the notch, they are present. Okay, now moving down here, you can see this, look at here, you can see this whole line, arc. This is the mandible, the whole structure, this is the mandible. And this was the part of the mandible. Now, how many parts you can see in this mandible? Over here, this vertical line here, this portion, this is called the ramus. This is called the ramus. Here, this structure, this is called the angle of mandible, or you can say the corner of mandible. And this is the body of mandible, the whole body. Over here you can see here, these are the central incisors. Below this incisor region, this particular area, this is called the symphysis region. This is the canine tooth, this is the canine tooth, and below this area, this is called the parasymphysis area. Okay, so this is the whole mandible. Now moving up here, you can see this dark white line extending from here till here. This is called the hard palate. This structure shows hard palate. And above this hard palate, you can see the white lines here, making a circle over here and over here. These structures are called sinuses, the maxillary sinus region. And this is the frontal region where the nose is lying. Here you can see the fovea. This is the foveal area of the nose. And over here there is another sinus, the frontal sinus. Moving here, you can see these tiny little bones here and tiny little bones here. These are basically the vertebrae, the neck region, the vertebrae. And over here below, you can see this small structure here and here. This is the hyoid bone. Inside the mandible, you can see clearly there is a line, a kind of a tunnel. It's a kind of a tunnel or a kind of a canal. This is a canal basically, in which there is a inferior nerve lies here. So this is the inferior nerve canal where the nerve is passing through it and giving sensations, inhibitions to these teeth. This is the premolar tooth. Below this premolar you can see this dark region here, and below this premolar here, this denotes the foramina. This foramina is called as the mental foramina, in which the mental nerve passes through it and gives innervation or nerve supply to this region of the tooth. So now we have discussed about the landmarks, the possible landmarks we have seen in this OPG. Now moving on, now I am going to tell you its indications in different fields of dentistry, different aspects of dentistry. This kind of X-ray is recommended for some cases. First of all, I'm going to discuss about maxillofacial surgery field, the surgical department. Why this X-ray is useful? It is useful to detect any mandibular fracture. Mandibular fracture, okay? What kind of fractures you can see, a surgeon can see. For example, if there is a fracture in this region, condyle fracture, or in this region, the ramal fracture. Here, if they can see the fracture here, this is the angular-mandible fracture, symphyseal fracture, body fracture, or any different kinds of fractures like pathological fracture, comminuted fractures. Also indicated in children also, they can see a kind of fracture. So this is useful for the surgeons to detect any kind of fractures, surgery point of view. So now moving on to another field of endodontics or operative dentistry field. Why there are few dentists, endodontists, they do this kind of X-ray? If the patient comes in the department with a complaint of pain all around the teeth, the patient cannot judge where the pain is heading towards. So this OPG is done to detect any kind of infection which is lying underneath the teeth. So as you can see here, these teeth, what kind of infection will be shown here? There will be a radiolucent or dark area around underneath the tooth that will show what any kind of infection related. So what the dentist can do, they can rule out the infection, they can treat it accordingly. And apart from infections, what an endodontist can see is when a patient presents with a carious tooth. If there is a caries in the tooth, they can see how deep the caries it is, and is it infiltrating the pulp region or not. Will this go for an RCT, or will this be resolved by just a simple tooth filling material? Alright. And they can also see any kind of infection in the sinus region. It is very useful to see any kind of infections. Apart from infections, what we can see here, we can see any kind of tumors which are present, any kind of cysts which are present around the mandible region, or any kind of region of this OPG. We can see any kind of cyst. Alright, now moving on to the field of prosthodontics, in which they make crowns, bridges, dentures. So why this kind of OPG is important for them? Why? In order to assess the bone, you can see the teeth, these are in underneath this bone. This is the alveolar bone region. What the prosthodontists do, they see the amount of bone present. Either the candidate is good for an implant or not, or we can go for any kind of prosthesis. This just see the amount of bone is present. Sometimes there are some patients you can see this kind of bone is resorbed, is not visible. It's called the bone resorption. Sometimes there are some of the roots of the teeth, they are also resorbed. We see the resorptions. Alright. Or we can detect any kind of ankylosis in the tooth. So what the prosthodontist do before placing an implant, he will get this OPG, he will see the bone, if the bone is sound, adequate enough for the implant to be inserted here. So the process want to see the kind of bone, amount of bone, any resorption is there or not. And finally, moving on to the field of orthodontics. In the field of orthodontics, why this X-ray is important? It is important to see any kind of malalignment present in this OPG, any kind of malalignment present, or to detect any kind of pathology. If before starting orthodontics, your multiple procedures are done before that. For example, if patient comes with restorations required, with scaling required, all these should be done prior to orthodontics. That's why before starting treatment, we should get this X-ray done, which is very important. Why it is very important? I told you before, to see the any kind of malalignment in the teeth, and by this eruptions of teeth, we can judge the age of the patient also. Mind you, the number of teeth present in any OPG, what they indicate you, they can be indicative of the age of the patient. Then what is the age of the patient according to the Nolla stages? We will discuss about this in my next video about the Nolla stages of the different kind of teeth and their importance. So right now, for an orthodontist, this X-ray is very important to assess the age of the patient, to assess how many teeth are present, and to assess what kind of dentition is it. Is it a primary dentition, mixed dentition, or a permanent type of dentition? So it is very important for treatment planning and diagnosis. Overall, this OPG, extraoral type of X-ray, it is very important in the field of dentistry. Why we should go for multiple periapical X-rays where you can do a complete whole mouth radiograph? The benefits are no treatment, no time will be spent, that cost will be reduced, and the radiation is also reduced. Only one time radiation exposure is there instead of multiple radiation exposures. So this OPG is very useful in the field of dentistry. So I hope you understood this video regarding this OPG X-ray, and if you have any questions regarding this video, regarding any question of this OPG, you can comment below in the link, in the video link, and I will soon give you the reply. Any kind of questions related to this X-ray, if you have not been understood, I will tell you again. And please do like my video, do subscribe it, press the bell icon, and share it to everyone you know regarding to this field of dentistry. I hope you have enjoyed this video, and I will see you soon in my next video. Bye bye.